Hello, we'll be discussing about the principles in healthcare waste management in this video. I'll be covering principles of biomedical waste management, evolution of healthcare waste laws, international biomedical waste management related conventions, laws for management of biomedical waste in India. This is from 1998 to 2020, which includes the waste management for COVID-19 wards. And also, I will summarize. So we'll come to the first topic of principles of safe biomedical waste management. The first principle is that polluter pays. Here, if I am the person who is causing harm to the environment because of improper management of biomedical waste, I am the one who is supposed to restore the environment either monetarily or in kind. The second principle is duty of care. What do you understand by duty of care? That means the individuals who are handling hazardous substances or equipment have to follow utmost care. These can be individuals who are within the healthcare facilities or those who are carrying the healthcare waste from the facility to a common biomedical treatment facility elsewhere. The third thing is sustainable development. This includes the 4 Rs that we discussed in the previous videos of reduce, reuse, recycle, and recover, where there will be proper organization of scarce resources for future generations. Fourth is the precautionary principle. Here, if the risk of the hazard is not known, we consider it as extremely hazardous and take necessary precautions. The last but not the least is the proximity principle, which means that treatment and disposal of waste which are generated in healthcare facilities should occur as close as possible to the facility which generates healthcare waste. This is to minimize risks of infection during transportation of these wastes. We will now look at the evolution of laws related to healthcare waste. The first ever mention of healthcare waste occurred in the year 1980, where USA East Coast noticed a lot of healthcare related waste like syringes, IV sets being washed up on the shores, and this caused an important environmental concern to the people in United States of America. They took this as a challenge and came up with the Medical Waste Tracking Act of 1988, where they formally laid down rules for medical waste tracking. In India, in 1986, the first ever mention of healthcare waste occurred. In UK, it was in the year 1990 with the enactment of the Environmental Protection Act. The Medical Waste Tracking Act was implemented partially and became a problem and a hazard as there was not a uniform implementation of this act. So the central government gave it to the individual states to come up with sound healthcare waste management principles for their own state. And from then on, each of the 50 states have their own healthcare waste management rules. However, in India, we still have, in 1998, we had the first ever healthcare waste management related public health legislation, which was named as the Biomedical Waste Management and Handling Rules of 1998. In UK, after the Environment Protection Act in 1994, they came up with the enhanced and a more stringent implementation of healthcare waste management called as the Waste Management Licensing Regulations. And after the first ever document for sound principles on healthcare waste management by the WHO in 1997, all other countries followed the suit, including India, with the enactment of the Biomedical Waste Management and Handling Rules of 1998, which was further modified in 2016 as the Biomedical Waste Management Rules of 2016. UK also improvised and improved on their healthcare waste management law of waste management licensing regulations and renamed it as hazardous waste regulations, which included many other hazardous waste, including healthcare waste. Some of the international conventions which were related to healthcare waste include the Basel Convention of 1989, which looked at the transboundary movements of hazardous waste and their disposal. In 2001, we had the Stockholm Convention, which looked at persistent organic pollutants. And in 2013, we had the Minamata Convention in Japan for mercury use. Coming to the Indian scenario, the first ever act, as I mentioned earlier, was the Environment Protection Act, under which biomedical wastes were mentioned under the Section 5. In 1998, following the Safe Biomedical Waste Handling Rules of 1997 by the WHO, biomedical waste management and handling rules was implemented. However, these was again re-looked at because of the number of categories that this act had, and the partial implementation in different states of India, and the lack of accountability for management and treatment of biomedical wastes. So in 2016, we had the formal biomedical waste management rules, which were later amended in the year 2018, 2019, and with the COVID-19 pandemic in 2020 also, which was under the Central Pollution Control Board guidelines. So this 2019 amendment is applicable to all healthcare units, irrespective of the number of beds, where they are supposed to maintain and update on a day-to-day basis how much biomedical waste they produce in a separate register called as the Biomedical Waste Management Register. This also has to be displayed on their website of the healthcare facility as to how much biomedical waste every month they produce, and an annual report of the healthcare facilities biomedical waste management needs to be also displayed. There are some waste, however, which are not covered under the biomedical waste management rule of 2016, as they are covered under various other acts which were enacted from the 1962 to 2008. These include radioactive waste, hazardous microorganisms, including genetically engineered microorganisms and cells, solid wastes, lead acid batteries, and hazardous waste. Few important definitions that we need to know as per the biomedical waste management rules of 2016 are the occupier, biomedical waste, and a healthcare facility. Occupier is the person who has administrative control over the premises generating biomedical waste. This usually is a medical superintendent of the healthcare facility. Biomedical waste, as per the latest guidelines, is any waste which is generated during diagnosis, treatment, immunization of human beings or animals, or research activities, or in the production or testing of biologicals, or in health camps. A healthcare facility is a facility which uses diagnosis, treatment, immunization of human beings or animals, which is provided irrespective of the type or the size of healthcare treatment system by the primary, secondary, or tertiary and research activity. So the highlights include that compared to the 1998 guidelines, there are rules laid down for the occupier for the common biomedical treatment facility. There were about 10 categories of wastes which were mentioned in the previous module, which were now color coded and in a more simplified manner, and packaged and transport and storage related guidelines were mentioned clearly. This also includes pre-treatment of certain wastes. This also lays down the guidelines for monitoring and implementation of these rules in healthcare facilities, which comes about the accountability part of biomedical waste management, and annual report preparation and display of biomedical waste at healthcare facilities website, accident reporting, and maintenance of various records. As per the 2019 amendment of this 2016 rules, records of waste generated from the COVID-19 wards related to COVID-19 has to be maintained separately and should be stored separately. For this transport of waste, we should use dedicated trolleys intramurally and they need to be labeled as COVID-19 water-related wastes. To summarize, every country is obligated to have legislations that promote sound biomedical waste management. In India, it comes under the Ministry of Environment, and in the first ever mention, it was the Environment Protection Act, Section 5. The current guidelines are laid down in view of 2019 uh, COVID-19 related guidelines as well in 2020 by the Central Pollution Control Board, and the latest amendment being regarding the COVID-19 war related wastes which were generated and how to dispose and label and store and treat them. Thank you.